5, 4, 3, 2, 1. Prepare yourself for an insightful journey into the world of knee injuries common in snow enthusiasts. As we glide down this icy slope of knowledge, we'll uncover the chilling reality of the 5 most common knee injuries that skiers and snowboarders face. We'll learn about their symptoms, treatments, and most importantly, how to avoid them. So, fasten your seatbelts, or should I say tighten your ski boots. Now brace yourself as we delve into the number 5 knee injury on our list. At number 5 we have the anterior cruciate ligament or ACL injury. Nestled in the heart of the knee joint, the ACL is a sturdy little band of tissue that plays a pivotal role in providing stability and facilitating movement. Think of it as the knee's personal superhero, saving the day by ensuring your knee doesn't wobble like a jelly every time you take a step. However, like all superheroes, the ACL has its kryptonite. A sudden change in direction or a hard landing, common occurrences on the snowy slopes, can overstress the ACL, causing it to tear. Now, how would you know if you've been hit by an ACL injury? Well, it's not subtle. You might hear a popping sound followed by intense pain, and your knee may swell up like a balloon. You might also find it difficult to walk or bear weight on the affected leg. But fret not, there's a silver lining. With immediate medical attention, an ACL injury is treatable. Depending on the severity, treatments can range from physiotherapy to a surgical reconstruction of the ligament. But remember, prevention is better than cure. Proper warm-ups, conditioning, and using appropriate equipment can help minimize the risk of an ACL injury. That was the ACL injury, folks. Let's move on to the next one on our list. Coming in at number 4, we have the medial collateral ligament or MCL injury. The MCL is a band of tissue on the inside of your knee. It helps to stabilize the joint, and like any other part of the body, it's susceptible to injury. Imagine you're on your skis or snowboard, carving down the mountain, and suddenly, you take a spill. If your knee gets twisted or hit from the outside, it could lead to an MCL injury. It's one of those moments when the exhilaration of snow sports meets a sobering reality. So what does an MCL injury feel like? Well, you may experience tenderness and pain on the inside of the knee, swelling, and in severe cases a feeling that your knee is going to give out. It's not something you'd shrug off. Now, if you suspect an MCL injury, it's crucial to get it checked out. Your healthcare provider may suggest rest, ice, compression, and elevation, commonly known as the RICE treatment. For more severe cases, physical therapy or even surgery may be necessary. Remember, early diagnosis and treatment can make a world of difference. It's all about getting you back on the slopes safely and confidently. With that, we conclude the MCL injury. Now let's move to the third knee injury on our list. At number 3, we have the meniscus tear. The meniscus is a C-shaped cartilage in your knee that acts like a cushion between your shin bone and your thigh bone. It's crucial for absorbing shock and ensuring smooth movement of the knee joint. Unfortunately, the meniscus can tear during activities that cause direct contact or pressure from a forced twist or rotation. A sudden pivot or sudden stops and turns can lead to a meniscus tear. This is one of the reasons why it's a common injury amongst snow enthusiasts. Symptoms can include pain, swelling, stiffness, and a feeling that your knee is giving way. You might also experience difficulty moving your knee or inability to move it in a full range of motion. Treatment can range from rest and physiotherapy to surgery if the tear is severe. The key here is early detection and prompt treatment to prevent long-term complications. That sums up our number 3 knee injury. Now on to the next one. Sitting at number 2, the lateral collateral ligament or LCL injury. The LCL is a thin band of tissue running along the outside of your knee, connecting your thigh bone to your lower leg bone. Its main job? To keep the knee stable, especially when it's subjected to sideways force. Now, imagine you're out there carving your way down a snowy slope. One wrong twist or sudden shift in direction, and bam! Your LCL could be sprained or even torn. The telltale signs? Pain on the outer side of your knee, swelling, and a feeling of instability when you try to stand or walk. But don't let that dampen your spirits. LCL injuries can be managed with rest, ice, compression, and elevation. The good old RICE protocol. Severe cases might require physical therapy or even surgery. Remember, it's crucial to give your knee the rest and rehabilitation it needs. That was the LCL injury, folks. Now let's move on to our top knee injury. And finally, at number 1, we have patellar dislocation. This is a condition where the kneecap, or patella, moves out of its normal position, usually to the outside of the knee. It often happens as a result of a sudden change in direction when the foot is planted on the ground. Symptoms of a patellar dislocation can be quite obvious. You might experience intense pain, swelling, and an inability to walk or move the knee. The kneecap may also look out of place or at a strange angle. The treatment for patellar dislocation usually involves putting the kneecap back into place, which is followed by physical therapy to strengthen the knee and improve flexibility. In severe cases, surgery may be required. It's crucial to seek immediate medical attention if you suspect a patellar dislocation. That concludes our countdown of the top 5 knee injuries. Remember, always consult with a doctor or qualified healthcare provider. We've now unmasked the 5 nastiest knee injuries every snow enthusiast should know about. From the anterior cruciate ligament injury to the dreaded patellar dislocation, we've covered it all. Remember, prevention is key. Warm up properly, condition your body, and use the right gear. And of course, always consult with a healthcare provider before self-treating any injury. If you enjoyed our content, don't forget to like, subscribe, and ring that bell for more. Stay safe out there, and see you in the next video.